If you're wondering what's going on in the news with pediatrics, parents, kids with coronavirus, all those updates, then this is the video for you. What we're going to talk about today is the Kawasaki's like multi-organ system inflammation issues that we're seeing in the news. We're going to talk about vaccines and masks and when to return to normal and what's that going to look like. So stick around if you're interested in finding out more about coronavirus and all of those issues. Today, we're going to talk about the number one question that I've been getting all week on social media and in the office, which is Kawasaki Syndrome or the I can never actually remember the name of it, multisystem inflammatory syndrome in children associated with coronavirus 2019, MIS-C COVID-19. Long name, really scary. Lots of people are concerned. And I'm hearing a lot on social media. Basically, I'm doing this update because all week long I collect questions and I collect articles to read so that I can understand better and share with parents what's going on with coronavirus right now. This is May 15th, and we are still in the midst of coronavirus. We are still in the midst of what looks like the peak in our state. Other states have already peaked. Other countries are reopening and everything like that. But I wanted to talk through some of the issues that we're seeing. The number one thing that I'm getting asked about right now, and if you're wondering, how can I ask him a question? The number one place is Instagram. I do Instagram stories and answer questions on Instagram all the time. So I take requests for questions quite frequently on my Instagram stories, and I have thousands of people that read my Instagram stories and ask parenting questions. It's mostly not coronavirus. It's about potty training or starting solid foods or sleep training or different things like that. But there are lots of coronavirus questions. The number one question about coronavirus that I got this week was about Kawasaki syndrome, or this multi-system inflammatory syndrome, and what all that means. This is an evolving thing. It was first recognized in the UK that there were not a lot, I shouldn't say a lot. There were a few cases of children that had coronavirus and also had serious, severe multisystem inflammation. And then as coronavirus struck New York, that started to come to light. And there were more cases in New York and in the earlier states that had coronavirus in the United States that were having children recognized as having multiple systems involved, inflammation, severe disease. A couple passed away, which is terrible, and a function of both the severity of the disease in those regions and the numbers that were affected. Yes, everybody's talking about how kids are less affected by coronavirus, but that doesn't mean they're completely spared. And we know that there's going to be cases in kids. There's going to be plenty of asymptomatic or mild disease in kids, but there are going to be those that have severe illness, and there are going to be those that pass away from it, which is terrible. Fortunately, the number one takeaway that I want you to have for this Kawasaki's disease concern, multisystem inflammatory syndrome, is that it is rare. It is something that we can watch for. What we see, so Kawasaki's disease, I'll just depart a little bit and just tell you about Kawasaki disease in general. It is something that's been around and noted for a long time. In my practice, I see about 4,000 patient visits per year, and I see maybe one actual case of Kawasaki's disease every other year, or maybe two every 2 years, or something like that. And then, do an evaluation in probably 3, 4, 5 kids over the course of a year, wondering if that's what they have. So it is not common compared to all the other ailments that we see on a regular basis. And even the kids with prolonged fevers and everything like that. We see a lot more kids with prolonged fevers than we do with Kawasaki's disease. And just because you have prolonged fever, the likely thing is that you do not have Kawasaki's disease. Kawasaki's disease is the reason for it is unknown. There's been lots of theories over time about why it strikes kids mostly. It seems to come in groups, which makes you think that there must be some viral cause that we haven't identified. They used to think that it was after cleaning carpets. That has been ruled out. There's been a lot of different theories about what causes Kawasaki's disease. But basically, the inflammation system in your body turns on. Now, under normal conditions, your body responds to infections by creating inflammation. The inflammation helps to kill those viruses or bacteria or whatever infects you. So you see inflammation in the form of fever. That's something that's normal. When your body is under attack and it's trying to defend itself, if it turns the temperature up, that is less hospitable to viruses and bacteria, and that's one way that it responds. But what can happen in the case of Kawasaki's disease as the inflammation ratchets up and ratchets up and ratchets up and ratchets up, and it gets too high and it causes other issues. We're talking irritability, we're talking about prolonged fever, we're talking about rashes, swollen lymph nodes, red eyes, red tongue, very uncomfortable, very irritable kids with Kawasaki's disease. Luckily, we have really good treatments for it. The one thing that you see frequently is about the coronary artery aneurysms. You have the arteries around your heart that supply your blood vessels, or they are the blood vessels that supply your heart with blood, and they get enlarged, or the inflammation strikes there as well. And so that is the main reason that we try and identify kids with Kawasaki's disease early, get them treatment. The fortunate thing for us as clinicians is we actually have a good amount of time to make that diagnosis, to get them treatment, to prevent coronary artery aneurysms. So the vast majority of kids that have Kawasaki's disease, we treat them, they get better, they don't have any long-term issues from Kawasaki's disease. That's a little bit about Kawasaki's disease in general. Now, we're seeing a Kawasaki's disease-like illness in some children with coronavirus. It's unknown why certain kids develop this. It's unknown if only kids get it or if adults get it as well. It's unknown why we're seeing a large number in the New York cases. Did those happen throughout the world? Probably. We probably just don't know it very well yet and haven't got the data back. The first cases were described in the UK, so it preceded the New York cases. So there's nothing special about the United States coronavirus that's causing it. It's essentially the same virus that has struck the rest of the world. So there doesn't seem to be any specific reasons from a epidemiological standpoint that it's striking in US kids. We're detecting it now. Everyone's radar is finely tuned. What are parents to do? What should a worried parent do? Nothing different. It's rare. It's unlikely that even if your child gets coronavirus that they will experience this. It's very, very rare. So hopefully that gives you some peace of mind that we're seeing thousands and thousands and thousands of cases in the United States of coronavirus and very, very small numbers of this multisystem inflammatory disorder syndrome. And so the likelihood that your child will be affected is very low. What should you do differently? Nothing. Continue social distancing. Wear masks when you go out. Call your physician, call your pediatrician if you have concerns. I can tell you that a lot of kids still get fevers even though we're social distancing. They have other viruses. They have strep throat. Other things that will cause fever are much more common than multisystem inflammatory syndrome. I'm not going to get used to saying that. Than that in kids. So a day of fever is not something where you need to worry that that's what's going on with your child. If they get coronavirus, they're likely to have a fever. So it's not unusual just because we have coronavirus that we get a fever. That does not mean we're progressing towards this multi-system inflammatory syndrome, Kawasaki's like illness in kids. So please rest assured that we will keep close eyes on this. If your child is having symptoms, perfect opportunity to call the doctor, perfect opportunity to talk it through. We can identify kids that are at risk for this if they've had multiple days of fever, if they have other issues where they're having inflammation in other organ systems, in the heart, in the kidneys, in the skin, in the respiratory system, in their GI system. If they're having multiple areas of inflammation, and we have ways, with lab tests and evaluations that we can analyze those things and make that determination, then we can get them the appropriate monitoring, evaluation, and treatment. There is treatment for Kawasaki's disease. You get a special infusion of a medicine called IVIG. If you've ever donated plasma, basically IVIG is a bunch of pooled antibodies that help turn down the inflammation in your system. Getting into too much detail here. Going to move on. But I want to tell you and reassure you that it is normal to worry about these things because we see them on the news. We see them being highlighted on the news, but There are a lot more kids that are going to get coronavirus. They're going to have a fever. They're not going to get Kawasaki's disease. The vast, vast majority of children that acquire coronavirus will not get multisystem inflammatory syndrome. So please be assured in that. Please keep in touch with your physician if you have questions. Now, I'm going to make those go away. Boom. A lot of people have also been asking about the vaccine. How soon are we going to get the vaccine? Is the vaccine the key to reopening the country? The vaccine will not be out for a long time. We're not making plans based on the vaccine right now because we will be planning for a long time to deal with coronavirus before we get the coronavirus vaccine. It will be the fastest vaccine ever brought to market whenever it comes to market. It will still be a good 9 to 18 to 24 months away from getting the vaccine, which means we are going to live with coronavirus in our communities for a long time before we have a vaccine. The reason to stay at home, the reason that we've been doing social distancing to this degree is because we've been trying to prevent that surge that overwhelms the hospital system. We cannot prevent every case of coronavirus by doing this unless everybody just goes into complete seclusion and isolation for the next 18 to 24 months, which is not feasible for the economy. It's not feasible for families. It's not feasible for anyone that has a job or has to go to the grocery store or has to make a living. That is just not feasible. Right now, what we're trying to do is prevent that peak from peaking so high that our hospital systems are overwhelmed and we're having to make difficult choices about who gets care. So far, the bulk of the country has been doing a really good job of keeping that number below hospital system capacity so that we're not having to make those difficult decisions that other countries around the world faced. Fortunately, we've had more time to prepare, and so we've done a better job than them because we've had that time to figure these things out because we haven't been overwhelmed. Now, there are states in the country that have had a much more severe disease burden, New York being the leader of the pack, and we've had over 80,000 deaths from coronavirus. That was not even something that was a thought in anyone's head 6 months ago, is that we would have 80,000 unplanned deaths because of a virus that no one had heard of. So, as you're seeing all these things on the news, as you're hearing from competing views and opposing viewpoints, keep in mind that everybody is doing the best that they can to figure this out, but it is not entirely clear now what the right courses of action are. And so we're all trying to figure this out together and get the little snippets of data that we can. In terms of vaccines, what I want you to do is make sure that your child is keeping up to date on the vaccines that they're due for. We have vaccines at 1 month, at 2 months, at 4 months, at 6 months, usually not at 9 months, at 12 months, at 15 months, at 18 months. And most children by their 2-year checkup are then done with vaccines until they get to the 4 to 5 range, until they get to the 11-ish range when they have the 7th grade physical. We usually do those at the 11-year checkup. But we still need to keep up on our vaccines. I just was talking this morning with a reporter about this issue because we're seeing a huge drop across the country, across our state, across our city in terms of vaccine administration and immunization rates. Appropriately, people don't want to go out. People don't want to come to the doctor. But we still need to keep up on our vaccines because what we don't want to happen is everybody goes out and things reopen, and then we have measles or whooping cough or chickenpox or pneumococcal or meningitis. Those vaccine preventable diseases are still out there. And if our vaccine rates drop dramatically, what we'll see is resurgences of those and outbreaks of those, like we saw in the past years with the measles outbreaks in unvaccinated people being out in the public. It does not take a large number of people not getting their vaccines for these things to pop back up, which is why we've had measles outbreaks, why we've had whooping cough outbreaks in those communities where they don't vaccinate. And so even though we are saying stay at home, social distance, you should still be seeing your pediatrician on a regular basis to get those important vaccines. We have all worked really hard. I was just on a call earlier this week with a bunch of pediatricians from around the state, and I've talked online with countless physicians in my physician Facebook groups about the practices that they've been putting into place to make sure that people can safely come to the office. Right now, people are mostly waiting in their cars. Our waiting room, we could repurpose it if it wasn't like right where the doors are, because no one is in the waiting room. Everyone's waiting in their car. They're getting a text message or a phone call to come into the office, and that's how they're getting into the office. They're seeing just the nurse, just the doctor, and then leaving right back there again. You're having less exposures than going to the grocery store or going out in public otherwise. And we've been really intentional about that so that we can keep people coming in appropriately for their well visits. What we don't want is a vaccine preventable illness. What we don't want is somebody to say that they're so worried about coming to the office that we're missing growth or developmental milestones that we need to, or that they have chronic issues like asthma or diabetes or other issues that are not being appropriately addressed because of concern. So call your pediatrician. There's actually a hashtag. I hope I'm not spoiling the beans, but next week there's going to be a hashtag by the National AAP on call your pediatrician. We want to see you in safe ways. Some visits we need to see you in the office. We can't give immunizations over telemedicine. Some things we can do over telemedicine. I have to show you. I even wear a mask on telemedicine. And the kids, they love that I wear a mask on telemedicine. So I'm going to do, here's my telemedicine mask. Oh my gosh, the kids get such a kick out of it. Sometimes the little ones don't love it so much, but they love seeing the mask, and it's a good reminder to wear your mask. Telemedicine visits are possible. We still want to see you. We still want you to feel that you can reach out to us and get the help and the support that you need in this difficult time, and get the vaccinations. Keep up with developmental checks and growth checks and all of the issues that you're facing, because those things don't stop. We also know that there's a lot of, especially young adults, teens, even younger kids that are really struggling emotionally, mood-wise, and we are here for you for that too. So I know that there's a lot of teens out there that are having worsening anxiety and worsening depression. And so we want to be there for them too. And we want to see you for those well visits in those teens, so that we can make sure and monitor those things. Because I see a lot of kids for sports physicals in the summer, and I rarely find things medically that are wrong that we need to address before we sign their form so that they can do baseball or track or golf or whatever it is. But I see a lot of kids that have undiagnosed, unrecognized mental health issues, mostly anxiety and depression, or self-harm or substance abuse issues. And what we're seeing is nobody's checking in on them. Parents often attribute it to teenage angst or being withdrawn because this sucks, like this is sucky, and they just hang out in their rooms and are on their phones. But we know that if we can be there for teens as a place to have a safe place to discuss those things, that more of those issues come to light. I have seen a lot of kids that the parents felt like they were doing totally fine or acting like themselves or just typical teen stuff, but they had underlying anxiety or depression that wasn't being identified, and they were at much higher risk for self-harm and suicide than the parents realized. And we were able to intervene because we saw them for that sports physical that they had to come in to get their form signed, but then we uncovered more serious issues that we can address, intervene, and make huge differences in their short and long-term health. Call your pediatrician. The last, actually, no, I still have a couple more things that I want to talk about. I got a list here because otherwise I just get completely sidetracked, and I'll be putting my Chewbacca mask on again while I try and think of what to say next, but I do need a drink. Locally, what are we seeing? We are seeing what seems to be a plateau, what seems to be a leveling out of the disease in our state. So this top picture here is the number of positive tests, which is dropping. Now, we've had some local issues with getting tests. There's been this whole Test Nebraska drive, but there's been a lot of local issues with that. But we have seen the cases leveling out. You can see in this middle graph here, the cases are leveling out in the terms of the number, which is good. Now, what we need to see is a sustained leveling out and dropping of the number of cases. You can see here on the far right part of this that there is a dropping of the number of cases. There's been less testing this week too, but hopefully what that means is we've reached our plateau, and we'll see in the coming weeks a dropping of the cases. When can we return to normal? When can we return to daycare? When can we return to the pool and swimming lessons, soccer practice? I think we're at our peak. I think we've reached our plateau, and I'm hoping that next week at this time I'll be able to say, here's the stepwise approach that we can follow to get back to normal and get back to our regular routine and what we have done. We're still going to be social distancing. We're still going to be doing masks for quite a while. But my hope is that next week I'll have good news in terms of here's things that you can get back to. Is now the right time to return to church? We will not be at church on Sunday. I will just say that. I we're church going people. We never miss mass. We that's an important part of our lives, but I don't feel like now is the right time to re-enter for our family, especially because who knows if I have um, coronavirus and I'm asymptomatic right now, but in a few days from now I have it. There's a lot of people out there in similar shoes, not just healthcare workers, but people that have been out in the public or have seen people that have been out in the public. Asymptomatic spread is really the issue because hopefully people will say, gosh, I'm sick. I have a cold. I have a stuffy nose. I have a fever. I'm not going to go to church. But there's a segment of the population we know that are asymptomatically going around spreading coronavirus without knowing it, and they'll be sick next week. They'll be going about their normal business until they fall ill. And then all the people that they exposed before then is really what I worry about with going back to church. I know our church has put in awesome measures to keep everyone as safe as possible. We're still going to do Facebook Live Church this weekend, to be determined when we're actually back in the pews. That's something that we want to do, but we're not quite there yet as a family. It's something that you can talk about and think about, but I would really think in the big picture about who else could we potentially expose? Who else could we accidentally acquire it from and then accidentally expose by going out to do things that we can still wait to return to? That's my soapbox pulpit moment on church. The last thing that I want to talk about is masks. And I've gotten such great response from people from my messaging on masks. I'm going to make this go away because I'm afraid it's going to cover up my face on accident. I've been a ardent supporter of masks, as you know, because we have very little that we can do to help others in the community other than social distancing. We still have to go to the grocery store. We still have to be out in public to some extent. When we do that, we wear masks. The reason for that is not to trample on our civil liberties or feel like you're being told what to do and how dare they tell me what to do. I was on a run this morning and I saw a dog on a leash and it made me think that dog parent, their civil liberties are being infringed upon because they're being told that you have to keep your dog on a leash. Well, what if I don't want my dog on a leash? What if I just want to let my dog run free while we walk around the neighborhood? Well, the leash serves the public good. The leash doesn't help you much other than your dog running off because your dog doesn't bite you. Your dog doesn't pee on your leg or run up to kids and knock them over. The leash helps everybody else that's out in the community, and it gives people a sense of peace that, okay, I see that dog. That's a really big dog. That dog could knock me over, and I worry, what if my kid pulls that dog's fur and the dog bites my kid? Well, if they're on a leash, that worry is reduced. If they're on a leash, that serves the public good while interfering with your personal rights to have your dog run free about the world. And so there's so many examples. Smoking in restaurants, which people were against until everyone loves not coming home from a bar or restaurant smelling like a cigarette tray. What do you call those? Ashtray. Sorry. Seatbelts. Another thing where it serves the public good to wear your seatbelt. It serves the public good to not go 75 in a 25. Those are things where we are infringing upon your personal freedoms to protect the public good. There are many examples in living in society where the public good trumps your personal liberty to drive as fast as you want, to drive on the wrong side of the road, to let your dog run around free in the neighborhood. The public good matters. And if you're saying, I'm not going to wear a mask because I'm not worried if I get sick, you're not protecting yourself with the mask. What you're doing is saying, I don't know if I could asymptomatically have coronavirus. I'm going to wear a mask to keep my germs to myself so that if I cough, breathe, or sneeze on someone else, they're less likely to get coronavirus because they might see their grandma. They might be a grandma. They might have diabetes or an underlying disease that I don't know about. I don't know what the grandma down the street has or who the kid in the checkout line goes home to care for. And so I'm going to wear a mask so that I don't accidentally infect the kid at the checkout line at the grocery store who has to work all day around people that could be coughing and sneezing and coming in to get their bananas when they have a fever, that is going to take coronavirus accidentally home to the loved one that they care for that's at higher risk. That's why we wear masks. It's not a political issue. It's not a civil liberties issue. It is a public health issue. If you won't do it for yourself to protect yourself, do it for the people that you're going to see in the world. Do it for your own parents and grandparents or loved ones that have an immune, that are compromised or at higher risk. Do it for them. Wear a mask for them. I will get back up on my pulpit or soapbox for 1 minute. Every morning at breakfast, we read the daily gospel. Like there's a different gospel reading every day. Somebody, picks it for the whole church, and I don't know how that works. But we read the gospel. Yesterday's gospel, John 12 something, included love one another as I have loved you. And then I opened it up today to read it over breakfast again. And I started reading the passage and I was like, wait, we read this yesterday, and I had to flip back and figure out if I had read the wrong thing. Not the exact same passage, but two overlapping passages. Love one another as I have loved you. So it was important enough that they spent 2 days on it. They made me do a double take because I thought I had read the wrong passage. The kids were all like, Dad, you read that yesterday. Love one another as I have loved you. Every religion has their version of that. It's not just a Christian thing. If you love your neighbor as yourself, you would wear a mask because you're loving the people that are closest to you by protecting your neighbor, the person that you see at the grocery store, the teenager that has to work to help support their family, or the person that has diabetes or COPD or asthma or immune disease, to keep living by wearing a mask. It's not about you. It is not about your civil liberties to not wear a mask. I am passionate about this because I hear and see a lot of people that feel like it is imposing upon them to wear a mask when really it's about everyone else. It is not about you. Off the pulpit, I hope that next week I can share good news in terms of a stepwise approach to returning to the things that everybody loves. I think right now we're on the cusp of things improving, but I would urge you and plead with you to please, please, please don't run out and celebrate. Don't put yourself and others at risk because we're seeing this plateau. Because then what will happen is 2 weeks from now, everybody that was asymptomatically, shedding the virus and infecting others right now, 2 weeks from now, those people will all be sick and will say, oh my gosh, we just teensily opened up and everybody got sick. And so now we need to hamper down, we need to clamp down things even tighter because we just had another surge. Let's keep things low in the coming weeks so that we can more quickly get back to those things that everybody loves and wants to do. I hope this has been helpful. This was a really long rant. It actually went way longer than I was expecting, but I had a lot of questions. And if you'd like to connect, the fastest ways to do it, my Facebook group, if you go to drb.show/join, you can join my Facebook group. My Instagram handle, @raisinggoodparents. I answer questions every day on there from parents. And I'm going to keep doing that because I've gotten such good feedback that it's so helpful. Those are the main places to find me. I also have a podcast. It's called Parenting Matters. If you go to drb.show/listen, you can find that and listen if you like podcasts. Keep up the good work. Please take a moment, share this. I know it was really long, but I would love it if you would share it so that other people can see it and get the good information that they need. There's a lot of information out there. It's hard to know who to trust. And I hope that I have earned your trust through showing up and being present and sharing my experience, what I'm hearing, what I know, what I've learned, and we can get through this and be stronger for it in the end. Take care.